We talk a lot about race, income, and insurance status as barriers, but even in the setting of having some type of insurance coverage, a lot of people have other structural barriers in place that prevent them really being able to truly access care.
We had observed in some of our emergency general surgery populations specifically that while a lot of our patient population does have access to health care, that patients were still not getting timely care and presenting emergently for conditions that potentially can be treated in an elective setting.
That has implications. It increases your time burden for the appointment by double what it might take if you had a car, for instance, and in some cases triple. But when you factor in that people have to take additional time off from their job to go to an appointment to get care electively in a day, you may be looking at them having to take an entire day off to be able to make it to an elective surgical appointment. And so you're adding barrier after barrier, and they tend to compound themselves. And so that's how transportation alone can be a huge part of the equation.
There are 144 census tracts in Denver that we were looking at. Overall, the drive time was 12 minutes compared to a bus time of 33 minutes. And so that gets at a population who doesn't have access to a vehicle. Patients who don't have access to a vehicle across the city, the estimated bus time would be 28 minutes as compared to a drive time of just 11 minutes. When we looked at patients who lived in census tracts with a increased minority population, those census tracts had actually longer bus time. And so this gets at that double effect. So you already don't have access to a private vehicle, so you are potentially relying on public transportation. And then those very same census tracts who have high rates of lack of access to a vehicle and high rates of minority populations are at an even increased disadvantage.
But we know which census tracts are disproportionately affected by not having good public transportation access. And so that is something that is actionable at a local level. And you can look at this locally, regionally, etc., but it helps you pinpoint where the actual issues are. When we talk about a lot of the barriers, we're not going to do anything about someone's minority status, but we can impact transportation. We can impact the type of housing available. We can impact educational opportunities. And so GIS helps us focus on modifiable barriers